Hey everybody, welcome to the channel. This is Dr. B. The channel is Dr. B360 at Dr. B360 Official on YouTube. Just recently, I covered a video on what you do being on Suboxone and if you have an emergent situation where you need pain control, traumatic event, breaking a leg, skiing, driving your car. And I hope I put some people's minds to rest regarding this issue because I am often asked regarding this issue. But there is three related topics that I did not cover in that video, and they were brought to attention, one of them by a viewer and one of them by myself and a third one by a friend. And I think it's important for you to understand the overall picture on this issue, and hopefully I leave you with some education and you enjoy this video. Let's get started. The first one, we talked about how first responders, emergency medicine doctors, how the pain can be controlled and the receptors can be filled while you're on Suboxone with additional pain control, and it's something you shouldn't worry. I want to introduce a medication, Sufentanil. Okay, this is actually fentanyl-related opiate. It's in a sort of the same class. It's a fentanyl family member. It came around in the early 70s by the same company that came up with fentanyl. But there's something to be noted here. Why haven't you heard of it? Why is it not used? This stuff is 5 to 10 times more potent than fentanyl. And number two, it's a pretty dangerous medication. Number two, the key point here is this. On this medication, its binding to the receptor is stronger than Suboxone and buprenorphine. Whereas when you give fentanyl in an emergency pain situation, you're trying to overwhelm the receptors, any open receptors, and you're sort of playing with time wherever you're at when you got your dose of Suboxone and trying to saturate what's left and hoping the Suboxone is falling off with time. This medication, besides the fact that it's 5 to 10 times more potent than fentanyl, all of the other properties are pretty much like fentanyl. It's half-life, onset, it's irrelevant. The point is, even the fact that it's so much more potent, the only reason that is important is that this medication is always used in a professional setting, and so it doesn't become dangerous in that way. But what is important is the fact that its binding to the receptor is much stronger than Suboxone, so it kicks Suboxone out. And where is this stuff? Who uses it? Where, what context is it in? Well, interestingly, it is used in surgical settings, ICU settings, often in major surgeries to get additional pain control. You often see anesthesiologists use it in cardiac surgeries, okay? And you don't really hear of it other than that. Well, in Canada, it's apparently also used by a lot of doctors. And again, they know how to manage the dose and they get pharmaceutical grade. It should only be found at the pharmaceutical grade level because, you are dealing with a lot of street medicine where people have nasty abscesses, a lot of painful wounds. You're changing dressings that could be extremely painful. In the hospital, I would often give fentanyl for these situations. But now you're dealing with somebody on Suboxone on the street, maybe even. And this is the medication that's used in Canada. And they're very well aware of the fact that it overwhelms the receptors because of its binding capacity, which is stronger than Suboxone. This is really important information, and I'll let you think about, well, why is it not used here more often? Why is it not more available? But it is there, and I don't know if you ever do have a major traumatic, painful event and you are awake, alert, oriented enough to communicate with the ER docs and they are informed that you're on Suboxone and you're not getting pain control, you can tell them, call anesthesia, tell them to get me that other fentanyl that overwhelms my Suboxone receptors so I can get some pain control. Okay, this needed to be said. This needed to be introduced. There's a lot of factors surrounding this issue that we can discuss. Why it's not more available, why all emergency physicians don't know it, why is it not even carried on the rigs with first responders? And it's not because of its potency. I believe they carry fentanyl nowadays. I haven't been in that environment for a while, but it would be something that in a society that is aware of the number of people on Suboxone and emergency situations come up for people on Suboxone, if all the systems were appropriately in place, you'd get your Suboxone. One of the instructions you would get is, hey, if you were ever in an accident or potentially a wristband like we do for other health things, patient on Suboxone, and everybody has this medication under a rig. As of now, that's not the case, and most doctors don't even know about it. That's that issue. Let's go to the next issue, which is Sublocade, okay? There was a couple of comments online, and in fact, the same friend that brought up the issue of the pain medication mentioned something about Sublocade. The idea is that if you are on Sublocade, you are screwed, right? This stuff is, you just got this injection and it's in your body and it's in there for a month. So a couple of points on that. Not really, not necessarily so. If you are on the 300 milligrams, again, don't forget, time does play a role in all of this, depending on when you got your shot, if it was yesterday or if it was 20 days ago, quite a bit of that is off, and you kind of do the same thing and try to overwhelm the receptors, whether it's with fentanyl or whether it's with morphine or anything else in that hospital setting. All the things I said before apply. Let the doctor know if you can. If you are being intubated, that itself gives you some protection and they will eventually catch on. Actually, ideally, you might want to consider carrying a card saying, I am on Suboxone. I will need additional pain control if I can't communicate this with you. That's a little side thing and a different story. But there's another piece to this I want to bring up. Let's say you did get your Sublocade today or yesterday, and you had a injury that's traumatic and painful, and you need pain control. Are you screwed now? And I'm going to say, unlikely. Here's why. Just recently, maybe, I don't know, within the last few months, maybe within the last year, maybe just recently, they actually changed their dosing and have kind of approval where a person can come in, get their 300 milligrams of Sublocade, and then that would be their first time, their first loading dose. 8 days later, they can get another 300 milligrams. And then a month from there, 27 days, 28 days, whatever, they can actually continue with the regimen, whatever it is, 100 or nowadays even 300. What does that tell you? I have to really look into this and look at the studies done so I can kind of analyze the pharmacokinetics and the pharmacodynamics. And I think their argument is about loading, but we're talking about 600 milligrams of Sublocade in 8 days. Why does that matter to you? Most of you aren't in that situation where you've gotten 300 and then just yesterday got the other 300, right? Most of you are either on 300 or 100. What does that tell you? Even if you got it yesterday, right, the levels and the receptor saturation leaves a lot of room for being overwhelmed with additional opiates. This was the second thing I wanted to point out, which is really, look, even if you're on Sublocade, you will be okay. The third thing a viewer pointed out in a comment, and they sort of put it in their own words, but it was this idea that, hey, guys, don't worry about what happens tomorrow, right? Don't obsess over that. This is a great point because when I have patients and they approach me regarding this issue, like many issues, they often discuss how concerned they are or how they're obsessing over this. And he made a fantastic point, which I often do in the office, which is, look, you shouldn't worry about this, but here's the answer. Live your life. You have amazing, life-saving, stabilizing medication, okay? Anybody could ask that question. A diabetic can ask that question about the medications they're on. What if something happens and there's short of my medication? What if there's a natural disaster? What if the world's ending tomorrow? Anybody can ask that question. You have to live with the tools that you have and use those tools to rebuild yourself, your coping mechanisms, your coping skills, whatever your previous issues were. Suboxone is no different. I hope this adds a little bit to your arsenal of knowledge, understanding, and maybe some enjoyment. Don't forget to like and subscribe. See you guys next time. Peace.